Musculoskeletal disorders are a leading cause of pain and reduced physical function for millions worldwide. Whether it's an acute injury or a chronic condition like osteoarthritis, finding effective, accessible treatments is crucial. One common approach is local heat application, or LHA, which includes methods like heat wraps, hot packs, and mud baths. But how effective is heat therapy for relieving pain and improving function? In this video, we'll explore the latest research, including a comprehensive meta-analysis, to see what science says about using heat for muscle and joint problems. Musculoskeletal disorders refer to conditions that affect muscles, bones, and joints. These can range from sudden injuries, like sprains or strains, to chronic issues such as arthritis or fibromyalgia. Symptoms often include pain, stiffness, and limited movement, which can significantly impact daily life. Even healthy individuals can experience muscle soreness after intense or unusual activity, known as delayed-onset muscle soreness, or DOMS. Understanding these conditions is key to appreciating why effective treatments like local heat applications are so important. Local heat application works by raising the temperature of the skin and underlying tissues. This increase in temperature leads to vasodilation, or widening of blood vessels, which boosts blood flow and oxygen delivery to the area. As a result, tissue healing accelerates, muscle tension decreases, and the elasticity of connective tissue improves. These physiological changes can help reduce pain, increase range of motion, and promote overall recovery. But does the evidence support these benefits in real-world settings? To answer whether heat therapy truly works, researchers conducted a systematic review and meta-analysis. This means they gathered data from multiple clinical trials and combined the results to get a clearer picture of the overall effects. The studies included adults with various musculoskeletal disorders, comparing local heat application to other treatments like cold therapy, exercise, standard care, medication, or placebo. The outcomes measured included pain, physical function, disability, muscular strength, quality of life, range of motion, and stiffness. Meta-analysis found that local heat application provided significant immediate pain relief compared to no treatment. This effect was especially strong in people experiencing acute pain or exercise-induced muscle soreness. In these cases, heat wraps or hot packs applied for several hours a day led to noticeable reductions in discomfort. However, for chronic conditions, the benefit was smaller but still present. These findings suggest that heat therapy can be a valuable tool for managing pain, particularly right after injury or intense activity. Beyond pain relief, local heat application was shown to improve physical function, especially in chronic conditions like osteoarthritis and low back pain. Patients reported being able to move more easily and perform daily activities with less discomfort after using heat therapy. These improvements were observed both immediately after treatment and up to 48 hours later, indicating that the benefits can last beyond the initial application. This makes heat therapy a practical option for those seeking to regain mobility. Interestingly, the studies also found that heat therapy could help restore muscular strength, especially after exercise-induced soreness. Participants who used heat wraps or packs regained strength more quickly than those who received no treatment or cold therapy. This effect was most pronounced within the first 48 hours after intense activity. While the number of studies on this topic was limited, the results suggest that heat may play a role in faster muscle recovery. When it comes to quality of life, the evidence was mixed. Some studies found that people using heat therapy reported better overall well-being, particularly when compared to exercise therapy. However, other comparisons, such as heat versus standard care or medication, showed little difference. This suggests that while heat therapy can help with pain and function, its impact on broader aspects of life may depend on individual circumstances and the type of comparison treatment. Another important outcome is range of motion, or how freely a joint can move. The meta-analysis found that heat therapy could increase range of motion and decrease stiffness, especially when compared to pharmacologic therapy or placebo. These effects are likely due to the increased tissue elasticity and reduced muscle tension that come with warming the area. However, the benefits were not always seen when compared to cold therapy or standard care, highlighting the need for individualized treatment choices. Common question is whether heat or cold is better for musculoskeletal pain. The research showed that, in most cases, there was no significant difference between heat and cold therapy for pain relief or quality of life. Both approaches can be effective, and the choice may depend on personal preference, the type of injury, and the stage of recovery. For example, cold packs might be better immediately after an acute injury to reduce swelling, while heat can help relax muscles and improve movement later on. Compared to exercise therapy or standard care, heat therapy showed some advantages, particularly for immediate pain relief and improved physical function. However, over the longer term, exercise remains essential for recovery and prevention of future problems. Heat can be a helpful adjunct, making it easier to start moving and stick with rehabilitation routines. Combining heat with exercise and other therapies may offer the best results for many patients. Studies also compared heat therapy to medications like ibuprofen and to placebo treatments. Heat was often as effective, or even more effective, than medication for immediate pain relief, improving disability and reducing stiffness. Compared to placebo or sham treatments, heat therapy consistently showed greater benefits. This highlights heat as a safe, accessible alternative or complement to medications, especially for those who want to avoid drug side effects. The results are promising. It's important to note some limitations. The studies included in the meta-analysis varied widely in terms of participants, conditions, and how heat was applied. Many had unclear or high risk of bias, and some relied on self-reported outcomes, which can be subjective. The number of studies for certain outcomes was also small, making it hard to draw firm conclusions. More high-quality research is needed to confirm the best ways to use heat therapy. If you're considering heat therapy, there are several practical points to keep in mind. Most studies use temperatures around 40 degrees C, applied for periods ranging from 20 minutes to several hours. Heat wraps, hot packs, and mud baths were common methods. It's important to use heat safely, avoid burns, and don't apply heat to areas with poor sensation or circulation. For many, heat can be a cost-effective, self-managed way to reduce pain and improve function, especially when combined with other treatments. Summary: local heat application is a widely used, generally safe method for managing pain and improving function in musculoskeletal disorders. The evidence suggests it's especially helpful for acute pain and as an adjunct to other therapies. While not a cure-all, heat therapy can make a meaningful difference for many people, helping them move more comfortably and recover faster. As always, consult with a healthcare professional to determine the best approach for your specific needs.